Welcome to the 2023 Fentanyl Awareness Week courses. This campaign began to bring educational awareness to the fentanyl crisis in our community in the spirit of bringing the latest and best information to the public. A wide variety of organizations throughout the community have partnered together. The collaboration is housed under the Keep New Mexico Alive campaign, and detailed information can be found on keepnmalive.com.
Good morning, everybody. I am Miranda Lopez. I am the New Mexico Public Health Analyst under the National Overdose Response Strategy, which is a collaboration between the Office of National Drug Control Policy and Center for Disease Control and Prevention. I am co-located with the New Mexico High Intensity Drug Trafficking Area Investigative Support Center, and I sit out of the U.S. Drug Enforcement Administration here in Albuquerque. So today I'll be first talking about the 3 primary drug threats in New Mexico that we are facing as a state, and then also along the southwest border. First and foremost is fentanyl, which is classified as an opioid, and also known as M30s or blues here in the Albuquerque area, New Mexico in general. It's the most common name for them in the area. Our second primary drug threat is methamphetamine. Our third primary drug threat in New Mexico is cocaine.
I'm Sergeant Paul Montoya with the Bernalillo County Sheriff's Office. I supervise our fugitive unit, our auto theft unit, and what's relevant today is I supervise our narcotics unit. Recently, probably in the last 3 to 4 years, I've really seen fentanyl really become more prevalent in our community, and it's a big problem.
Good morning. My name is Scott Garland. I'm the Assistant Special Agent in charge for the DEA up here in Albuquerque. So I have the northern part of the state of New Mexico. I'm going to talk to you today about drug poisonings, which is really our #1 threat here. DEA maybe was a little slow to come around to this. We're used to working cocaine and heroin, and fentanyl took us a little bit by surprise with the opiate crisis and then turning into the fentanyl crisis. We think it's the most urgent threat to our communities right now, and we're definitely focusing on it. The CDC tells us that it's the leading cause of death for Americans aged 18 to 45.
My name is Ryan Nelson. Fentanyl most abundantly sees street drug. Meth is second. And like you guys have indicated, and we've indicated on this panel, that we're seeing an increased combination of both the sale and use.
In the years of experience that you've been doing what you do, how would you consider the drug crisis in comparison to years ago that we have now related to fentanyl?
It's the worst I've ever seen. You know, there's no comparison. You have over 100,000 people dying every year of a drug. We've never seen that before. So there's no contest. Currently, it's as bad as it's ever been.
I'm Brandon Warwick. I'm a physician at UNM. I'm triple board in emergency medicine, medical toxicology, addiction medicine. I get to practice all 3 specialties, and part of one of my goals of the talk is to bring all of my specialties together. This is state specific. What has me concerned as an ER physician, as an addiction medicine physician, is the rate of methamphetamine going up. This is a big project that I have worked on. So the New Mexico Poison Center, where my physical office is, we are of the 55 poison centers, the only poison center to be taking addiction call. And we've been doing this for nearly 3 years now. This is a free call to you and to your friends, your family in the state of New Mexico. We have a series of pharmacists who receive basically a 2-year on-the-job training, and then they sit for an exam, and the exam is difficult. There's about an 80% pass rate. We have currently have maintained a 100% pass rate for people who are eligible of the board. Basically, whatever addiction questions that you have, we're ready for. Department of Health and other agencies over the last couple of years, we've increased our ability to do testing in people. And I think there's a big difference between what we're seeing in New Mexicans and what's being trafficked through the state. The good news is at this point, we're not seeing a lot of xylazine.
the federal definition for human trafficking. The first one, A, is sex trafficking, which is what we are primarily talking about today, which a commercial sex act is induced by force, fraud, or coercion, or in which the person induced to perform such act has not attained 18 years of age. The other thing is we need to understand that human trafficking is highly profitable. So when we look at both sex and labor trafficking across the globe, we're looking at over $150 billion industry of untaxed money that people, are able to profit from that is in that black market, so to speak. This is a huge, huge amount of money, and it's one that most experts would say is second only to drug trafficking. And when we think about it, it's likely that it could surpass drug trafficking because we know drug trafficking is limited because you can only sell a drug so many times, but you can sell a human, whether it's for sex or labor, over and over and over again. When people have experienced these types of things, it creates a vulnerability in them, and traffickers are predatory. They are going to look for people who are vulnerable, people that are easier for them to recruit, to groom, to bring into that situation, and all of these types of things can contribute to that. Now, the big one and what we're really looking at today is the substance use or parents who use substances. That is a huge, huge aspect of the human trafficking picture, and specifically of the sex trafficking picture here in Albuquerque. We also see, especially with opioids, that we know that they create a very quick and a very strong addiction within somebody, and so traffickers really do use that to control the victims that they are keeping control of. So that trafficker ends up being their drug supplier, and even if you are feeling like, I don't want to do this anymore, and you're going to try to walk away, if you don't have some support and for those substance cravings and all of that, you're going to go right back to that situation, and the traffickers know that. So they use that opioid, they use the fentanyl, they use that heroin as like a leash to bring those victims back to them over and over and over again.
As you all know, I'm Donald Hume. I am a person with lived experience. I'm also a person in long-term recovery, which means that I have not drank or used an illicit substance that was not prescribed to me in 31 years. As we go on the journey, we'll be identifying the things that we gain and the things that we lose. Remember that the next person that you run into is a brother, a sister, a mother, a father, a friend, a neighbor, or it may even be you looking in the mirror. So on this journey, what I'm going to do is I'm going to take you on a journey of a real person. A person that experiences stigma, the different ways that they experience stigma, the ways that you might experience stigma. It's part of life. And this is what we did wrong. We didn't love him the way that we needed to. We listened to people that had never been through it before. We let them tell us what was wrong with us. And so let me show you how to do that. Not the way that we did it, but the way that we learned how to do it. And we carry that message of hope, that we aren't throwaway people, that recovery is possible, and we give them a hug. And we tell them how proud we are of them, and that we'll do this together. We don't have to do it alone.
So when I think of stigma, I think of like that kind of a brand right, that people can see forever, right? Like it's not something that goes away, right? Just because of the stigma throughout it, right? If we think in terms of so many parts of that story, stigma just kept creating more and more barriers.
We have a choice. Are we going to make goosebumps, which is the good kind of word power, or are we going to, what do they call it, the skin crawling or the heebie-jeebies? We know when we're with people who are extremely stigmatizing and throwing around language that makes a lot of people uncomfortable, I actually kind of tense up and I can feel my body on edge. I've got family members in this category of people who use stigmatizing language on the daily, hour by hour, and it's painful to be around. And I also have family members who are the receiving end of all that stigma and those hurtful words. Hope it doesn't cost you anything. It is free. Being kind costs you nothing. Being snarky is actually quite costly across society. You saw it in Donald's story, how it ramped and built and, you know, kind of piled on is the phrase I like to use. Stigma is notorious for that. It just kind of snowballs into this horrible constellation of yuck. And it started out so small, teeny, and it ramped up across the community. And it can also unravel with hopefulness. You can change people's lives with a little bit of hope. It doesn't take actually that much.
My name is Brian Cerna. I'm with Cerna Solutions. Today we're talking about working with family members who have an addiction. So we're going to start with, what is the problem? The problem is most people with addictions don't access services, because one of the symptoms of having an addiction is having lack of insight about your addiction. Why do we do this? Well, it's because Dr. Myers was my mentor, and it was my first real job in the field was working underneath him. He's used me throughout my career. I've been working with him since 2001, so 22 years now. He's used me to train and certify people in this model all over the country, all over the world, and I've been teaching other people how to do this for so long.
What we're trying to do is teach the family member how to change the interaction in such a loving and caring and supportive way that this person, the drinker, doesn't get mad at them. And when they finally say, would you like to come to treatment with me? I think it would be helpful for the family. They don't go ballistic. We don't even bring up drugs or alcohol. We tell the family member, don't bring it up, because it's going to come up anyway. But initially, to get them through that front door, that's the key, to get them through the door.
There's no bottom. There's no bottom until you're in recovery. Then you can look back and say, that was my bottom. So we would never tell anybody, wait for them to hit bottom. It doesn't even matter, like, you know, that scenario where that young lady, that was like her first time breaking curfew. Now is a good time for that family to intervene. You don't have to wait for her to hit bottom. That would be nonsense. If you want to get help because you have a family member that you're worried about, or, you know, you have friends that need help, the best place to start is actually our website. CernaSolutionsLLC.com is our website.
So the first question is, can you provide an overview of the current state of fentanyl crises from your perspective? And why don't we start with Kenneth and let him tell us what he sees.
You know, I never thought, you know, like you have the methamphetamine, the meth in Navajo, we would say that you know, that something would override that and come in, and it's very much, it seems like about 80 to 90% of the people that I'm seeing are somehow connected with it. So that's the little portion that the northwest part of the state that I take care of. But if it's out there on our small towns on the reservation, then, you know, it's pretty well alive everywhere else. So I think it's growing, and there's starting to be a big need for, you know, some help or some treatment, you know.
Thank you, Ken. And Dino, how about you with the veterans? What are you seeing with the veterans?
Well, one of the things that I wanted to mention is that the population that I'm seeing affected by fentanyl isn't restricted to those that are seeking a high or trying to escape something. These are people that are coming off prescription medications from the VA. They've changed the policy. These are people who have gotten injured that haven't quite recovered, but they can't get their medications anymore. So they're seeking it out elsewhere. And we see this all across New Mexico, not just with the veteran population, but also with the farming communities. These elders that they're not out on the streets. They're not out running and gunning and playing those games.
Thanks, Dino. Rob, what do you see in Espanola?
Through our homeless shelter, we've seen the effect that it's had in that community, which is highly susceptible to the fentanyl epidemic. For those of you that are unaware, the county that I come from, Rio Arriba County, that actually includes parts of Santa Fe County, has historically had one of the nation's highest overdose rates per capita. I'm from that community and born and raised there, so I've seen it affect generations and generations of families. The shift towards fentanyl that I personally started seeing over the last 3 years can be pretty much summed up in this. When we would go out and collect our sharps containers that were full of needles as part of our harm reduction, that started shifting and we started seeing less and less and less. And now we could fill them up with foil.
Thank you, Rob. And Eric, how about you here in Bernalillo?
The amount of numbers that I'm seeing hasn't gone down anymore. I don't know if the people are getting smarter at using it. The overdoses have gone down a little bit, but I'm still running into a lot of patients that come in that said, I went and got meth, and they had to bring me out of it with Narcan. And Narcan doesn't work on methamphetamine. It's opiate. So they don't even know what they're getting still. They know the blues are bad. They know that the greens are bad. Now they have the Skittle-colored ones and stuff like that. But I'm still seeing a lot of people coming in that didn't know that that had that in it. And on the other extreme, I talked to a patient this morning that does about 25 pills a day. You know, and he was in for something related, not an overdose. So it's not getting better. It's getting worse.
And Shannon, could you please tell us what you believe or have seen some of the most vulnerable populations, and what are some strategies that you believe can be used to reach some of these individuals?
Our focus needs to be on having these recovery centers that follow the person through, not for 30 days, not for 6 months, sometimes years. It takes years. And also what I'm seeing is that we really need to focus our efforts on preventative measures. We need to get the word out to our kids. Like the children need to start hearing about this and learning about this and hearing it from people that have suffered this and gone through it, and to get that perspective out there and start putting preventative measures in place.
And we're going to talk about different forms of treatment. We're going to talk about medicines and non-medicine treatments. Only 3 medicines that work for opioid use disorder or for fentanyl addiction. What's important is that nothing else that's really been tried in terms of medicines works, and trying other things can result in death. So it's really only these 3 medicines. All 3 of these medicines are equally effective or equally kind of helpful. They're just different, and it's really cool to have different choices for different folks. Safe medicine, Suboxone, literally safer than aspirin. It's one of the safest medicines that we have. And again, very effective for addiction treatment. One of the other 3 medicines is methadone. We wanted to talk a little bit about that in methadone treatment. Methadone treatment is also very different because you have to go to a clinic every day. I like to say methadone is very safe inside methadone clinics and very dangerous outside of them. Some people need the structure of a methadone maintenance clinic where you go for daily dosing and really benefit and can thrive because of that structure. And then sometimes they can graduate onto the less structure with Suboxone or buprenorphine prescriptions. The third medication is naltrexone. or what folks might know as the Vivitrol shot. It's not an opioid. It's an opioid blocker. And so if somebody were to use an opioid, this would block it.
Good afternoon, and thank you for being here. My name is Walt Benson. I'm Bernalillo County Commissioner for District 4, and I'm also a small business owner. I'm a financial advisor, and my family also owns 2 Baskin-Robbins ice cream stores. And this is a very personal conversation on multiple levels in terms of friends and loved ones. I've had many people that have been affected personally by the drug epidemic, specifically fentanyl. In terms of an employer, we're constantly dealing with it. We're very fortunate to have this conversation with employers who represent the business community, because the impact of fentanyl affects not just individuals, but the community at large. We all know someone, family member, or loved one who struggles with addiction. As business owners and managers, we must deal with employees or their family members who are entangled in a similar situation by providing resources while maintaining understanding and patience. We have the opportunity today to discuss the financial impacts of employee turnover and spiraling crime, including vandalism and burglary to our businesses, from those seeking to support desperate addiction of all kinds. To my right is Joseph Shaw. He's the Director of Nonprofit Operations at Fathers Building Futures. Fathers Building Futures' mission is to ensure parents experiencing the barriers of incarceration have the opportunity to experience their full potential financially, emotionally, and socially by providing services such as life skills, employable employee trainings, parenting classes, financial literacy, case management, and a paid position in their job training in their workshop, where they provide a basic introduction to woodworking and welding. Fathers Building Futures for the past 11 years has served over 450 fathers coming out of incarceration, reunite with their families, obtain full-time employment, and turn their lives around. In terms of the education, I've got 4 children, and it's just brutal. So what advice would you give to parents or grandparents in terms of educating children?
You know, my neighbor, he's got boys, and they're all grown. And fortunately, they didn't get caught by the monster either. But he said the battle, and you know, of course, I could relate with him with having my daughters. The battle of them growing up in a drug culture. We are a drug culture. And parents have got to put a stop to that. The moms, I remember being, when I was a little kid, but we had the 60s, and that was the big boom, right? Everybody do what you want. And the 70s were a disaster zone. And I think we're there. I think we're back into that. I think we're in the 70s. And who saved the day but moms? Moms saved the day. Moms had had enough. And we had the 80s, and we had the big war, cocaine, whatever wars, but you didn't have the just filth and the degrading of communities like in the 70s, because moms stood up and went, "That's enough." That's a fact. And I'm so moms. Love moms, because that is the key.
But if we stay the course, and if we continue to pull together, and we continue to have groups or nonprofits, fathers building futures, and that's what we need. And so I just wanted to say thank you, and if we can continue to educate employers to just letting them know that this is a big deal. There's going to be more people coming through the door, and when they do, let's find some humanity and support for them. So thank you.
I have just one more point to make, that for employers, that it is very important, because we are in the crisis that we're in, because we're dealing with fentanyl, which is an opioid, very important for employers to have Narcan on hand, to have Narcan to be able to save a life, because you may have an employee, you may have a customer that comes in that overdoses, and Narcan does save lives. So I wanted just to encourage all employers to make sure that they get trained on the harm reduction side of the house. You administer Narcan. There's a Good Samaritan law where you will not get charged, you will not get in trouble for dispensing Narcan and saving lives. So I do want to encourage all business owners to make sure that they have Narcan available in case there is a situation that they encounter.
Real quickly, if we can all just maybe stand up real quickly and just take a deep breath together, because I feel like that was such a great journey, and for all of us who have struggled, either ourselves or family members, we know that struggle, we know that feeling, and so I feel like we just take a deep breath together.